Kia ora, good afternoon. First of all, thank you, Joe, Vidya, who's somewhere, and the Whanau Tahi team for giving me the privilege to speak here today. My name is Diana Foran and I am a pharmacist. I work 2 days a week with Robbie Hannon in a community pharmacy in West Auckland and 3 days as the project lead for the Owning My Gut project at Counties Manukau. So over the past 2 years of my walking life, I have developed a keen interest in learning about patient-centered care, health literacy, health IT, integrated care. I am an ardent follower and admirer of the work Nick and IFIC does, as well as improvement science. At the recent 2017 New Zealand Pharmacy Awards, my team and I were honoured with a few awards, including the Community Pharmacy of the Year, Professional Service of the Year, the Innovations Award, and the Supreme Award. Today I would like to share with you a little bit about our improvement journey and what our success factors have been. In today's demanding and rapidly changing health system, all healthcare professionals have two options: to step forward into growth or to step back into safety. My question to everyone here today is, what are you willing to do? So, why change? The current New Zealand health system is under pressure in the near future as the population ages and the burden of long-term conditions such as diabetes, heart disease, and dementia grows. Health continues to use an increasing proportion of total government expenditure in a constrained funding environment. Long-term conditions consume a vast amount of New Zealand resources, both in terms of direct healthcare and indirect costs on society as a whole. Looking to the future, we will need to work differently to meet changing health needs. Current models of care do not make the best use of pharmacists' capacity and unique skill set or promote a one-team approach to providing health care. A statement from the New Zealand Health Strategy 2020 states that although the pharmacist workforce is young and highly qualified, their skills remain underutilized in the wider health setting. Yet good evidence shows that better use of these skills will improve health outcome and make the use of medicine safer. New Zealand has more than 3,500 practicing pharmacists. Around 75% of these work in community pharmacies, providing a range of services. There are close to 1,000 community pharmacists, which over 1.3 million people visit each month. The community pharmacist is often the part of the health system that people have the most regular contact with and easiest access to. The first thing that we pharmacists need to do is change our attitudes in order to take on new roles and integrate with the primary care team. We need to get rid of the narrow and inward focus, the negativity of the current healthcare environment, silo thinking, and taking a subservient approach. These thoughts and behavior needs to be replaced with a level of outgoing confidence, underpinned by pharmacy placing value on itself as a profession. A lot of work is already being done around integrating pharmacist services in the community. The 2012 National Pharmacy Services Contract was one of the first steps towards a patient-centered service model. There is also the New Zealand Health Strategy 2020 and the 5-year Pharmacy Action Plan. The Pharmaceutical Society of New Zealand and the New Zealand Medical Association have also co-developed the integrated care framework. So the theoretical foundation is strong. We know the what that we need to work together. We know the why. What we need to focus on now is the how. What are our change ideas? We need to start working from the bottom up as well, meaning small scale of changes in pharmacies starting now. I was listening to Jonathan Gray talk about climate, and he mentioned about the wicked problems in healthcare: limited participation, inadequate content, and ineffective infrastructure. I feel like pharmacists are faced with all of these wicked problems. Not many pharmacists in the community know about the Integrated Care Initiative and hence are not motivated to be a part of it. For pharmacists that know about it and want to change their practice, they don't have the adequate resources and support needed to allow for the change. My team and I at Waimaku Village Pharmacy have been working on the how for the past 2 years. As a team, we are committed to continuous quality improvement in all that we do. Over the past 2 years, we have evaluated and been optimizing our model of care and business design to deliver innovative, quality, patient-centered care. Our first critical success factor was collaborating with the primary care team, the GPs, the nurses, and the support staff. GP team buy-in and integration was critical. It made perfect sense for us both to be on the same page, so our patients had a unified and cohesive approach to their health care. We wanted to be seen as a one-stop shop and encourage the best use of resources, clinical knowledge, staff time, avoid patient delays, and avoid our patients getting the runaround. This has resulted in timely interventions and cost savings for patients, particularly for patients with complex conditions and health burden, by managing needs efficiently for them. Some may ask, so how do you build that collaboration? It's no rocket science. Do not underestimate the power of a cup of coffee and just talking to someone. Invest in the social relationship. We have team dinners every 2 to 3 months. We have joint Christmas functions. At the same time, another critical success factor was planning with the entire pharmacy team. So both the pharmacists and technicians. We don't have retail staff, so just the pharmacists and technicians. So that we had staff buy-in and engagement throughout the journey. It was also important to communicate openly and regularly with all staff, provide ongoing support, and giving them the opportunity to provide feedback. Also, provide opportunity and support for the staff to grow. We encourage pharmacists and technicians to take further studies, to attend conferences and workshops. We let our technicians champion projects, and they are responsible for the day-to-day running of the business. By using our technicians' times and skills more wisely, our pharmacists are able to spend more time with patients instead of merely dispensing and checking prescriptions. Next, we redesigned our model of care to place a greater focus on medicines management services. Currently, more than 1 in 6 New Zealanders aged 65 years or older are living with 3 or more long-term conditions. Older people prefer to live in their own home, and there is good evidence that people who continue to live in their own home with personal care and home management support where necessary have greater well-being. When older people have better access to medicines adherence and optimization services, progress can be made towards the goal of keeping people out of hospital and delaying admission to residential facilities. Our fourth change idea was to embrace technology to enable communication and integration. Unfortunately, while costs and staffing levels have risen, New Zealand's health sector has experienced a drop in productivity. Smart IT systems is a key enabler for productivity, efficiency, and quality in any sector. It would appear that healthcare IT could make a better contribution towards lifting our sector performance. The digitalization of healthcare records and the technology to connect the dots between siloed providers is critical to transforming and improving today's healthcare system. An evaluation by Linbai from the Auckland University demonstrated that pharmacy's process of data capturing is cumbersome. It's paper-based and distracted from the purpose of the exercise, that is to deliver actual care. We needed to spend less time on paperwork and more time actually walking with the patient. To overcome these problems, we at Waimaki Village Pharmacy adopted the Whanau Tahi shared care program. This IT ability has facilitated our workflow. We are saving an extra 2 to 5 hours per patient collecting and writing up the same background information. It has allowed continuity of care, increased productivity, and prevented repetition of work. Our time is better spent working with the patient. So, what has success looked like for us so far? As a result of these change ideas, that is, collaborating with the GP team, staff buy-in and engagement, redesigning our model of care to focus on medicines management services, and adapting Whanau Tahi shared care IT program, we have increased the number of patients receiving targeted medicines management service from 70 patients to 190 patients, and the number is still growing. We have enhanced communication between all care team members, which ensures the outcome is right first time. We have had major quality and safety contributions for at-risk patients and created efficiencies that reduce administrative overheads and repetitive paperwork. There has been direct cost saving for our patients as well as the GP and pharmacy business through timely interventions and less follow-up. There's staff job satisfaction, but most of all, we value spending time getting to know our patients and really understanding their needs. So, dust if you must, but the world is out there, with the sun in your eyes and the wind in your hair. A flutter of snow, a shower of rain, this day will not come again. Dust if you must, but bear in mind, change will come, and it's not kind. And when you go, and go you must, you yourself will make more dust. Thank you.